Okay. Good morning to all. Myself, T. Prabhu, Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. So today we are discuss about case study of anti-hypertensive agents. Okay. So what is the mean by hypertension? Hypertension means it's nothing but abnormally high blood pressure through the blood vessels in the body. Okay. So normal BP values, normal BP range is 120/80 mmHg. Okay. So here the child BP range of above 170 or middle age people's like that BP range of there is 160 mmHg. So variable parts of the BP ratio is different for the human being. Okay. So here first of all the ACE inhibitors. So what is the mean by ACE inhibitors? There is nothing but angiotensin converter enzyme. Okay. So here there is mainly focused on blood pressure. Okay. So here the angiotensin means the tension, the pressurized converter enzyme to the reactions of the blood vessels. Okay. So here the angiotensin converter enzyme 1 and 2. Okay. So the 1 and 2 is they are mainly focused on throughout the blood vessels in the body. Okay. So what they need of blood pressure throughout the vessels, blood vessels in the blood stream also. Okay. The vein passed throughout arterial vein, the cholesterol may be deposited on the blood vessels of a particular area of the veins, throughout veins. Okay. So here the blood flow ability is increased means there is interrupted of cholesterol level. Okay. So there is a deposit of cholesterol level. So it may induce the angiotensin converter enzyme. There is a drug reacted to the angiotensin 1 to another site of receptor coefficient reaction. Okay. So here there is a drugs of angiotensin converter enzyme 1 or 2. There is a blood vessels throughout the blood flow ability to continuous mode of action of converted to enzyme 1 or 2. Okay. Here the drugs of enalaril, captopril, lisonopril, ramipril. Okay. So here the mainly focused on congestive heart failure patients or cardiac arrhythmia patients to be followed by these angioconverter enzyme drugs. Okay. Here the mainly focused on throughout the vein, arterial vein, the blood flow ability to be increased for the help of drugs. Okay. So next one is alpha blockers. So what is the mean by alpha blockers? There is nothing but one of the pressure ratio recognized for the blocking agents of alpha blockers. Okay. So it will be enhanced to raise the low BP to high BP. Okay. So here the drug of atenolol alpha methyl dopa. Okay. So atenolol means it is one of the alpha blockers. It is a binding receptor site of 7 transmembrane receptor site. Okay. So another called name is G protein coupled receptor site. Okay. So the drug atenolol is bind to the G protein coupled receptor site. It will be enhanced to reduce the BP also. Okay. So here the alpha blockers will be reduce the blood pressure. So if you are having the pharmacological action due to reduce the blood pressure of alpha blockers. Okay. So another one is beta blockers. There is nothing but when the patient is having a low BP or low pulse rate, we have to given for the beta blockers. It will be enhanced rising the blood pressure ratio. Okay. So here the propranolol, esmolol, it will be regular pressure maintenance of drug. For example, propranolol. So propranolol is binding with G protein coupled receptor site. It will be produce the same hypertension drug. Esmolol is one of the beta blockers. So you have the same pharmacological action produce the body. Okay. Then is both alpha and beta blockers. So he is the most important things of alpha and beta blockers. So here the blood pressure is whether as systolic movement or diastolic movement, there is a blood flow ability to regulate the blood pressure, to regulate the blood pressure in the body. Because of the blood is one of the major syndrome of our organ. Okay, so each and every physiological part throughout the protein synthesis and metabolism take place, whereas the blood is passed through the all physiological parts of the body. Okay, so here the both alpha and beta blockers, it will be maintain the BP, it will maintain the blood pressure. Okay, so here the example of drug of losartan, valsartan. The losartan and valsartan is both alpha and beta blockers. They will be help to regulate the BP. Okay. Another one is diuretics. Okay. So what is the mean by diuretics? Diuretics is nothing but it is increase the urine output. It is a anti-diuretic properties. Here the properties of thiazide derivatives. The drug is hydrochlorothiazide, chlorothiazide. It will be